welcome to the deep dive. Today, we're going to be taking a really close look at adrenal and incidentalomas. You're probably here because maybe you've heard this term recently after a scan, or maybe you're just curious about them. You want to get the facts straight.
Yeah, and we're here to help you do just that.
Exactly. We're going to be using information from up to date. So you can trust that what we're talking about is solid medical knowledge.
Absolutely.
Okay, so let's get down to business. Two major questions pop up when we talk about adrenal incidentalomas. Is it malignant and is it functioning?
Right.
But before we dive into those questions, maybe we should start with the basics. What exactly is an adrenal incidentaloma?
An adrenal incidentaloma is basically a mass that's found in your adrenal gland. And usually it's found by chance.
Oh, really?
Yeah, like during a scan for something else completely.
So it's kind of like a surprise?
Exactly. Like you go to the mechanic to get an oil change and you find out you need a whole new transmission.
Oh, I see. That makes sense.
It's a bit of a surprise.
So these surprises, are they common?
They are, actually, especially as we get older.
Okay.
Get this. 1 in 10 people over 60 could be walking around with an adrenal incidentaloma and not even know it.
Wow. That's a lot of people.
That's a significant number.
So why is that? Why is it so common? And what does it mean for healthcare? Are we overusing scans? Should people in that age group be doing anything differently, preventative measures, or?
Those are some really important questions. And honestly, they're still being debated in the medical community. One thing's for sure, though. With more and more CT scans and MRIs being done, we're finding more of these incidentalomas.
It makes sense.
So we need to be prepared to address them in a smart way.
Okay, so let's talk about the scary part, malignancy. When we find one of these incidentalomas, how worried should we be about cancer?
Okay, so the good news is that most adrenal incidentalomas are benign. That means they're not cancerous.
Okay, phew, that's a relief.
Right. So that's a big sigh of relief right there.
Yeah. But you said most are benign. How do doctors figure out which ones are more concerning?
Right. So there are some red flags. Size is a major one.
Okay.
If the incidentaloma is bigger than 4 centimeters, it raises some eyebrows for sure.
Okay.
Almost all adrenal cancers are larger than 4 centimeters when they're first discovered.
So size matters, literally.
Exactly. But it's not just about size.
Okay.
CT scans can also give us clues.
Oh, interesting. So tell me more about that.
So think of it like this. When a doctor looks at a CT scan, they're not just seeing a blob. They're looking for very specific characteristics
Okay.
to help them determine what they're dealing with. For example, adenomas, which are benign, usually have a lot of fat in them.
Okay.
So they actually show up darker on the scan.
I see. They're less dense.
Yeah, think of it like a sponge.
Oh, okay.
And then there's something called the washout pattern.
Washout pattern. Okay.
Adenomas clear out the contrast dye that's used in CT scans much faster than other masses. Like imagine pouring water through a sponge. An adenoma would be like a very porous sponge, letting the water flow through quickly.
Oh, okay. That makes sense.
Yeah.
So it's like doctors are looking for clues to figure out the likelihood of cancer, like the size, the density, this washout pattern, all those kinds of things.
Precisely. And this is where a specialist's expertise is crucial. They can interpret these signs, sometimes very subtle signs, and figure out the best way to proceed.
Okay, so we've talked about the first big question. Is it malignant? Now let's move on to the second one. Is it functioning? What does that even mean when we're talking about incidentalomas?
Good question. So sometimes these incidentalomas, even if they're benign, can start producing hormones. And they often do this without any noticeable symptoms. It's kind of like a secret agent working behind the scenes.
Okay, so it's not just about whether the mass is cancerous, it's also about whether it's messing with our hormones.
You got it. And the most common hormonal issue we see with these is subclinical Cushing's syndrome.
Okay, I've heard of Cushing's syndrome, but what makes it subclinical?
Think of it like a dimmer switch.
Oh, okay.
With full-blown Cushing's syndrome, you've got all the lights on, right? Obvious symptoms like weight gain, muscle weakness, even a very specific round face.
Okay.
But in the subclinical form, it's like someone's turned the lights down. The symptoms are way milder and sometimes so subtle that they go completely unnoticed.
So it's like it's hidden.
Right. But even though it's less dramatic, it can still have a big impact on your health over time.
So it's like a slow burn, potentially causing problems down the road.
That's a great way to put it.
But how do doctors diagnose something so subtle? Like, if the symptoms are barely noticeable, how do they even know it's there?
Well, that's where the overnight dexamethasone suppression test, or DST, comes in.
DST, okay.
Like shining a spotlight on those dimmed lights, helping us to see what's really going on.
Okay.
Basically, this test measures how your body's cortisol levels respond to a dose of dexamethasone, which is a type of steroid.
So the DST can help doctors figure out if the adrenal gland is producing too much cortisol, even though the symptoms aren't really obvious.
Exactly. It's a powerful tool for uncovering this hormonal imbalance that might otherwise be hidden.
That's fascinating. So what happens if someone is diagnosed with subclinical Cushing's? Do they automatically need treatment?
That's where things get a little tricky. The decision of whether or not to treat is complex. It depends on a lot of different factors.
Okay.
Doctors have to consider the patient's age, their overall health, how severe the hormonal imbalance is, and of course the potential risks and benefits of the treatment options. It's not a one-size-fits-all situation.
It sounds like a balancing act, weighing the pros and cons, I guess.
Exactly. That's why it's so important to have good communication with your doctor. They can help you navigate all these complex decisions and make the best choice for you.
Okay, so subclinical Cushing's is the most common hormonal issue, but are there any other hormonal curveballs that these incidentalomas can throw at us?
Yes, there are, actually. A couple others we need to be aware of. Pheochromocytoma, for example,
Yeah.
is much rarer than subclinical Cushing's, but it can be pretty serious.
Okay, in what way?
Well, this type of tumor releases hormones that can cause these, like, really sudden spikes in blood pressure.
Oh, wow. So that sounds dangerous.
It can be, yeah. It's like a roller coaster ride you don't want to be on.
So how do doctors even diagnose something like that? Especially if these blood pressure spikes are kind of, sudden and random.
Right, it can be tricky,
Yeah.
especially since those blood pressure spikes, they can come and go.
Yeah.
One of the main tools we use is a 24-hour urine test. We're looking for elevated levels of certain hormones that pheochromocytomas produce.
So it's kind of like detective work,
Yeah.
piecing together clues from the patient's symptoms and the hormone levels.
Exactly. And it's important to catch pheochromocytoma early,
Okay.
because if it's left untreated, those blood pressure spikes can lead to some pretty serious complications.
Okay, so we've covered subclinical Cushing's, we've covered pheochromocytoma. Anything else in the world of hormonally active incidentalomas that we need to be on the lookout for?
Yeah, one more to keep in mind is aldosteronomas.
Aldosterone, okay.
These tumors, they overproduce aldosterone, which is a hormone that helps regulate blood pressure.
Okay.
And they're a significant concern, especially for patients who already have high blood pressure or hypertension.
So it's like adding fuel to the fire.
Yeah, you could say that. That's why doctors are always on the lookout for aldosteronomas in their patients with hypertension. And the testing for that usually involves blood tests to look at the levels of aldosterone and renin, which is another hormone that plays a role in blood pressure control.
So we've got subclinical Cushing's, we've got pheochromocytoma, and we've got aldosteronomas.
Right.
That's a lot to think about.
It is, yeah. It's not just as simple as saying, oh, you have an incidentaloma, let's just take it out.
Right.
It's way more nuanced than that.
So when IS surgery necessary, what are the factors that doctors are kind of weighing when they're making those decisions?
Well, it depends on a lot of things. The size of the incidentaloma, what it looks like on the imaging, whether it's producing hormones, the patient's overall health, even their personal preferences.
So it's really individualized.
Absolutely. But there are some situations where surgery is almost always recommended. For example, with pheochromocytomas and adrenal cancers, the risks of leaving those untreated are just too high.
Right. Those are the more serious ones. What about the cases that aren't so clear-cut?
Even if the incidentaloma looks benign on the imaging, if it's larger than 4 centimeters, doctors will often recommend removing it,
Okay.
just to be safe.
Yeah.
Better safe than sorry, especially when we're talking about the possibility of cancer.
Yeah, that makes sense. What about the subclinical Cushing's cases? We talked about how the symptoms can be very subtle. Is surgery always the answer in those situations?
Not necessarily, no. Remember, we're talking about a condition where the symptoms might not even be noticeable. So the decision to operate is one that has to be made very carefully. Doctors have to balance the potential benefits of surgery with the potential risks of the surgery itself.
So it's a trade-off.
Exactly. Yeah. And especially for older patients or patients with other health conditions, sometimes watchful waiting might be a better approach. That basically means monitoring the situation closely with regular checkups, maybe some imaging, just to make sure that the tumor isn't growing or causing problems.
So you're always kind of assessing and reassessing to make sure that any intervention is truly necessary.
That's right. And the same goes for aldosteronomas. While surgery is often the best way to cure the condition, there are medications that can help control the aldosterone levels and manage the high blood pressure that's associated with it.
So for some patients, medication could be an option.
Yeah, exactly.
Yeah.
Especially for those who maybe aren't good candidates for surgery. It's really all about finding the right strategy for that individual patient. And a lot of times that involves kind of a combination of things, medication, lifestyle changes, and sometimes surgery.
This is reminding me of what we were talking about earlier about how as we get better at detecting these incidentalomas,
Right.
we need to be careful about not overreacting.
That's such a great point, and it's something that doctors are becoming much more aware of. Just because we can find something doesn't always mean we need to, jump in and do something about it.
Right, right. So for those cases where surgery is recommended, what can patients expect?
Well, luckily, surgery has come a long way.
Okay, good.
Adrenalectomy, which is the procedure to remove the adrenal gland, is much safer and much less invasive than it used to be.
Oh, that's great. So what does that actually look like?
Well, most adrenalectomies these days are performed laparoscopically.
Laparoscopically, okay.
That means that instead of a big incision, the surgeons are using tiny little instruments and a camera that are inserted through very small incisions in the abdomen.
So it's much less traumatic for the patient.
Exactly. Laparoscopic surgery usually means less pain, shorter recovery time, and fewer complications.
That's definitely a plus.
Absolutely. It's amazing how far surgical techniques have come.
So let's say someone has had surgery to remove an adrenal incidentaloma. What happens next? What does follow-up look like?
So even after surgery, follow-up is still really important. Depending on the type of tumor, the specific patient, it could involve blood tests to monitor hormone levels, imaging to check for any signs that it's come back, and of course managing any related health issues like high blood pressure.
So it's not just like, okay, we took it out, you're good to go. It's an ongoing process.
Right. And that's where that good relationship with your doctor is so, so important. It's all about working together to figure out the best follow-up plan for you.
It makes sense. This has been so informative. We've really gone deep into the different ways these things can be diagnosed, the different treatment options, how important it is to personalize the approach.
Yeah.
But there's one thing I want to kind of circle back to.
Okay.
And that's that feeling of, I don't know, uncertainty.
Right.
That can come with getting an adrenal incidentaloma diagnosis?
Yeah, it can be. It's a big thing.
Yeah. So how can people kind of deal with that, like that feeling, I guess, that often comes with getting that kind of a diagnosis?
I think the most important thing is to remember that, most of these adrenal incidentalomas, they're benign. They're not going to need any intervention. So that's, already a big relief right there.
Yeah.
And even in the cases where treatment is needed, we have really good options. And, medicine's always advancing. Outcomes are improving all the time.
So it's really about, focusing on the positives and knowing that there's help out there.
Exactly. And that's where, having a good support system can really make a difference. Your healthcare team, your family, friends,
Yeah.
even support groups. Just having people you can talk to who understand what you're going through can make a world of difference.
Yeah, it really does. It's about remembering that you're not just a diagnosis, right?
Right.
You're a whole person, and your emotional well-being is just as important as your physical health.
Absolutely. Sometimes just having someone to talk to makes all the difference in the world.
This has been so eye-opening. Thank you so much for taking the time to talk to us today.
It's been my pleasure. I always enjoy these conversations.
And to our listener, we hope you've learned something new about adrenal incidentalomas and that you feel empowered to be involved in your own healthcare.
Yeah. Remember, knowledge is power.
Absolutely. And as always, stay curious.